Hello, everyone. Before we start, make sure to like and subscribe to the channel and leave a comment with where you're from and what time you're watching. That way, YouTube will keep showing you stories just like this one. Now, let's begin. I'm a registered nurse at Mercy General Hospital in Portland, Oregon. Or at least I was until I submitted my resignation last month. You can call me Sarah if you want, though most people in the emergency department just called me nurse during my 15 years there. I've seen everything you can imagine in emergency nursing: car accidents, heart attacks, overdoses, stabbings, and every kind of medical crisis the human body can endure. But what I'm about to tell you about is the one case that made me question everything I thought I knew about medicine and ultimately led me to leave the profession entirely. Mercy General is a Level 1 trauma center serving the greater Portland metropolitan area and parts of southern Washington. It's a sprawling complex built in the 1980s with a 32-bed emergency department that handles about 65,000 patients per year. During my time there, I worked primarily 12-hour shifts, 7 in the morning to 7 at night, because I preferred the variety and pace of day shift emergencies. Day shifts in emergency nursing are relentless. You might start with a stroke alert followed immediately by a pediatric trauma, then move to cardiac arrests and psychiatric holds without a moment to catch your breath. The morning of March 23, 2023, started like any other Thursday. It was unseasonably warm for early spring usually meant, which we'd see our share of construction accidents, motorcycle crashes, and people getting back outdoors after a long winter. I had been on shift since 7 that morning, and by 10:30, we had already seen a steady stream of patients: a teenager with a skateboarding injury, an elderly man with chest pain that turned out to be a panic attack, and a woman who had cut her hand while gardening and needed stitches. I was restocking supplies in Treatment Room 6 when my charge nurse, Maria Santos, approached me with a look I hadn't seen in her 20 years of emergency nursing. Maria was known for her unflappable demeanor, even in the most chaotic situations. She had worked through natural disasters, mass casualty events, and every kind of medical emergency imaginable. But that morning, there was something different in her expression, a mixture of confusion and concern that immediately put me on edge. "Sarah, I need you to take the patient in room 12, she said, her voice carrying an unusual tension. "What's the story?" I asked, pulling on fresh gloves and mentally preparing for whatever complicated case was waiting for me. "That's just it. There isn't really a story." She was brought in about an hour ago by a good Samaritan who found her sitting on a park bench downtown. No identification, no belongings, no memory of how she got there or even what her name is. I had dealt with plenty of patients with altered mental status over the years. Drug overdoses, psychiatric episodes, head injuries, and medical conditions that could cause confusion or memory loss. But something in Maria's tone suggested this case was different. "What are her vitals?" I asked as we walked toward room 12. "That's the strange part. Everything is completely normal. Blood pressure, heart rate, temperature, oxygen saturation. All perfect. Her blood work came back clean too. No drugs, no alcohol, no signs of infection or metabolic problems." We reached room 12, and Maria paused before opening the door. "Sarah, I've been doing this for 2 decades, and I've never encountered anything quite like this." She's not confused or disoriented in the way you'd expect from someone with memory loss. She's alert, articulate, and seems completely lucid about everything except her own identity and how she ended up here. I opened the door and immediately saw what Maria meant. The woman sitting on the edge of the hospital bed appeared to be in her mid-30s with shoulder-length auburn hair and green eyes that seemed both intelligent and deeply troubled. She was wearing clean clothes, a navy blue sweater, and dark jeans. But like many unusual cases I'd encountered, there was something unsettling about the complete absence of any personal items or identification. "Good morning," I said, approaching her bedside with what I hoped was a reassuring smile. "I'm Sarah, your nurse. How are you feeling?" She looked at me with those piercing green eyes and spoke in a voice that was clear and steady. "I feel fine physically, but I'm terrified because I don't know who I am or why I'm here." There was something about her delivery that struck me immediately. Most patients with memory loss show signs of agitation, confusion, or distress that manifest in their speech patterns or body language. This woman spoke with perfect clarity and composure, as if she were discussing someone else's medical condition rather than her own mysterious circumstances. "Can you tell me what you do remember?" I asked, settling into the chair beside her bed. She was quiet for a long moment, her brow furrowed in concentration. "I remember waking up on that bench this morning. It was cold, and there was dew on the grass nearby. I knew immediately that something was wrong because I couldn't remember how I got there. But the strangest thing is that I remember everything else perfectly. I know what year it is, who the president is. I can recall movies I've seen and books I've read. I just can't remember anything about myself." This type of selective amnesia was extremely rare, and typically indicated either severe psychological trauma or specific types of brain injury that affected only certain areas of memory formation and retrieval. But her neurological exam had been normal, and her behavior didn't suggest the kind of dissociative state usually associated with psychological trauma. "Do you remember your name at all? Even a first name or nickname that feels familiar?" She shook her head slowly. "I've been trying to remember since I woke up. I keep thinking that if I concentrate hard enough, it will come back to me. But there's just nothing there. It's like someone erased part of my memory while leaving everything else intact." I continued my assessment, checking her reflexes, testing her cognitive function, and looking for any subtle signs of neurological impairment that might have been missed in her initial examination. Everything appeared completely normal. Her coordination was perfect, her speech was fluent and appropriate, and she could perform complex mental tasks without difficulty. She could do mathematical calculations, recall detailed information about current events, and demonstrate knowledge across a wide range of subjects. The most unsettling aspect of her presentation was how matter-of-fact she was about her situation. Most people facing complete memory loss about their identity would be panicked, crying, or showing some emotional distress. She seemed almost clinically interested in her own condition, as if she were observing it from a distance rather than experiencing it firsthand. "Have you had any dreams or flashes of memory since you've been here?" I asked. Sometimes fragments of memory can return gradually after a traumatic event. She considered this carefully before responding. "I did have what felt like a dream while I was resting earlier. I saw flashes of a white room with lots of equipment, people in scrubs moving around, bright lights overhead. But I couldn't tell if it was a memory or just my brain trying to make sense of being in a hospital." Her description of the white room sent a chill down my spine, though I couldn't articulate why at the time. There was something about the way she described it that felt both familiar and deeply unsettling. The level of detail, the clinical precision of her language, and the distant way she recounted what should have been a vivid and potentially traumatic memory. I spent another 30 minutes with her, going through standard protocols for patients with memory loss. We tried various techniques to trigger recognition or recall. I showed her common objects, asked about familiarants or sounds, and even had SCD her look in a mirror to see if her own reflection might spark some recognition. Nothing worked. She observed each attempt with the same detached interest, as if she were participating in a fascinating experiment rather than trying to recover her own lost identity. Dr. Patricia Chen, our attending physician, arrived around noon to conduct her own evaluation. Dr. Chen was a veteran emergency medicine physician with over 20 years of experience, and she had a reputation for solving difficult diagnostic puzzles that stumped other doctors. She spent nearly an hour with our mysterious patient, conducting the most thorough neurological and psychiatric assessment I had ever witnessed. When Dr. Chen emerged from room 12, her expression mirrored the same confusion I had seen in Maria earlier that morning. "Sarah, can you join me in the conference room for a moment?" she asked. "We need to discuss this case." I followed Dr. Chen down the hallway, passing the usual chaos of the emergency department. Paramedics were bringing in a construction worker with a possible spinal injury, families were gathered anxiously in the waiting room, and the familiar sounds of monitors beeping and staff coordinating care filled the air. But my mind was entirely focused on the woman in room 12 and the growing sense that we were dealing with something far outside the realm of normal medical experience. "Patricia, what's your assessment?" I asked as we sat down in the small conference room that smelled perpetually of coffee and disinfectant. Dr. Chen pulled out a thick folder and spread several documents across the table. These are her test results, and I have to tell you, I've never seen anything quite like this combination of findings. She pointed to a series of brain scans displayed on her tablet. Her MRI shows a completely normal brain structure. No signs of trauma, no lesions, no abnormalities whatsoever. Her CT scan is equally unremarkable. But look at this EEG we ran an hour ago. The brainwave patterns were unlike anything I had seen in 15 years of emergency nursing. Instead of the typical irregular patterns you might expect from someone with memory dysfunction, her EEG showed perfectly symmetrical, almost rhythmic wave formations that seemed to repeat in precise intervals. Patricia? What does this pattern indicate? I asked, though I suspected from her expression that she didn't have a clear answer. That's just it, Sarah. I've consulted with our neurologist, and he's never seen EEG patterns like this either. They're too regular, too organized. It's almost as if her brain is functioning on some kind of systematic protocol rather than displaying natural neural activity. The implications of what she was suggesting sent a chill through me. Are you saying her brain activity looks artificial somehow? Not artificial exactly, but highly unusual. Most importantly, these patterns don't correlate with any known form of amnesia or memory disorder. If anything, they suggest enhanced cognitive function rather than impairment. What? Dr. Chen continued flipping through the test results, each page deepening the mystery rather than providing answers. Her blood work is the cleanest I've ever seen. No traces of medications, no signs of recent illness, no indication of substance use. Her vitamin levels, hormone levels, and metabolic markers are all within perfect normal ranges. It's as if she has the healthiest blood chemistry of anyone I've ever tested. What about her physical examination? I asked. Any unusual findings there? Dr. Chen shook her head, but there was something in her expression that suggested she was holding back information. Her physical exam is remarkable for how unremarkable it is. No scars, no tattoos, no birthmarks, no signs of previous injuries or surgeries. Her muscle tone and reflexes are perfect. Her vision and hearing are exceptional. But Sarah, there's something else that's been bothering me. She paused, as if deciding whether to share what was clearly a troubling observation. When I was examining her hands, I noticed something strange about her fingerprints. They're there, but they're unusually faint, almost as if they've been somehow diminished or altered. And her dental work is equally puzzling. What do you mean about her dental work? I asked, though I was beginning to dread the answer. She has perfect teeth, which isn't necessarily unusual. But when I looked closely, I couldn't find any evidence of the normal wear patterns you'd expect to see in someone her age. No signs of previous dental work, no minor imperfections, nothing that would help us identify her through dental records. The conversation was interrupted by a knock on the conference room door. Maria Santos peered in with an urgent expression. Dr. Chen, Sarah, I think you need to come back to room 12 immediately. There's been a development. We hurried back through the emergency department, weaving between gurneys and medical staff. As we approached room 12, I could hear our patient speaking, but her voice sounded different somehow. More animated, more engaged than the detached tone she'd used earlier. When we entered the room, she was sitting upright in bed, holding a pencil and writing rapidly on a piece of paper. Her movements were fluid and precise, and she looked up at us with an expression that seemed more alert and focused than before. I've been remembering things, she said, her voice carrying an excitement that hadn't been there during my earlier assessment. Not about my identity, but about other things. Medical procedures, anatomical structures, pharmaceutical interactions. It's as if someone is downloading information directly into my brain. She held up the paper she had been writing on, and what I saw made my blood run cold. In perfectly legible handwriting, she had drawn detailed anatomical diagrams of the human cardiovascular system, complete with Latin terminology and precise measurements. Below the diagrams, she had written out complex chemical formulas for various medications and their interactions. Dr. Chen took the paper from her hands, examining it closely. Where did you learn to draw these diagrams? She asked, her voice barely concealing her amazement. I don't know, the woman replied. The information just started appearing in my mind about an hour ago. I can see medical procedures I've never performed, remember techniques I've never learned, and understand concepts that should be completely foreign to me. This was impossible. Medical knowledge at this level required years of education and training. The diagrams she had drawn were more accurate and detailed than what many medical students could produce after months of study. The pharmaceutical information she had written down included drug interactions that were known only to specialists in clinical pharmacology. Can you tell us what other information you're remembering? I asked, trying to keep my voice steady despite the growing unease I felt about this entire situation. She closed her eyes for a moment, as if accessing some internal database. I know that the patient in room 8 has a hairline fracture in his left radius that probably won't show up clearly on his initial X-ray. The woman in room 15 is showing early signs of diabetic ketoacidosis, but her blood sugar levels haven't spiked enough yet for a definitive diagnosis. And the elderly man who came in with chest pain earlier today has a small blockage in his right coronary artery that will require immediate intervention within the next 6 hours. The accuracy of her statements was terrifying. I had been involved in the care of all 3 patients she mentioned, and her assessments were not only correct, but demonstrated a level of diagnostic insight that surpassed what our attending physicians had initially concluded. This wasn't educated guessing or lucky coincidence. She was displaying medical knowledge and diagnostic abilities that defied any rational explanation. Dr. Chen and I exchanged glances that communicated our shared bewilderment more clearly than words ever could. The woman sitting before us was demonstrating medical expertise that typically required decades of specialized training, yet she claimed to have no memory of acquiring this knowledge. I need to make some phone calls, Dr. Chen said quietly. Sarah, can you stay with her and document anything else that happens? I nodded, settling back into the chair beside the bed as Dr. Chen left the room with obvious urgency. Over the next hour, I witnessed something that challenged every assumption I had about human consciousness and memory. The woman continued to write, filling page after page with medical information that became increasingly complex and specialized. She drew surgical procedures with the precision of an experienced surgeon, outlined treatment protocols for rare diseases, and demonstrated knowledge of cutting-edge medical research that had only been published in the past few months. What was even more disturbing was how she accessed this information. She would pause, close her eyes, and appear to be listening to something only she could hear. Then she would begin writing again, her hand moving with mechanical precision across the paper. Can you describe what's happening when you pause like that? I asked during one of these episodes. She looked at me with those unsettling green eyes, and for a moment, I saw something that might have been fear. It feels like someone is speaking to me, but not with words. The information just appears in my mind, complete and detailed. I understand concepts I've never studied, remember procedures I've never seen performed. It's as if I'm accessing someone else's medical knowledge. The implications of what she was describing made me physically uncomfortable. Are you saying you feel like someone else is in your mind? Not someone else exactly, she replied carefully. More like I'm connected to a vast database of medical information that I can somehow tap into, but I don't understand how or why this is happening to me. I excused myself to check on my other patients and found Dr. Chen in the hallway, speaking in hushed tones on her phone. When she saw me approaching, she ended the call abruptly. Sarah, I've been in contact with some colleagues at the medical school and the CDC. Nobody has ever encountered a case quite like this. We're dealing with something completely outside normal medical experience. What do you think is happening to her? I asked, though I wasn't sure I wanted to hear the answer. Dr. Chen was quiet for a long moment, choosing her words carefully. There are only a few possibilities, and none of them are good. Either she's experiencing some kind of unprecedented neurological phenomenon that medical science can't explain, or she's not who or what she appears to be. The second possibility hung in the air between us like a toxic cloud. What do you mean by that? I asked, though part of me already suspected what she was going to say. Sarah, I've been practicing medicine for over 20 years. I've seen every kind of psychiatric condition, neurological disorder, and medical mystery you can imagine. but I've never encountered a patient who could suddenly access detailed medical knowledge that would take years to acquire through normal education and training. She paused, looking back toward room 12. Her fingerprints are barely detectable, her dental records would be impossible to match, and her blood chemistry is too perfect to be natural. Combined with the medical knowledge she's displaying and the complete absence of any personal history, we have to consider the possibility that she's not exactly human in the way we understand it. The words hit me like a physical blow. Are you suggesting she's some kind of artificial intelligence or android? Dr. Chen shook her head quickly. I don't know what I'm suggesting. All I know is that what we're witnessing defies every principle of human biology and psychology that I've learned during my career. We were interrupted by Maria Santos, who appeared at the end of the hallway with an expression of barely controlled panic. Dr. Chen, Sarah, you need to see this immediately. Something's happening in room 12. We followed Maria back down the hallway, and as we approached the room, I could hear a low humming sound that seemed to be coming from inside. When we opened the door, the woman was standing beside her bed, with her eyes closed and her arms extended slightly from her sides. The humming sound was coming from her, a steady rhythmic tone that seemed to resonate through the entire room. More disturbing still, the medical equipment in the room was responding to her presence. The cardiac monitor was displaying perfect sine wave patterns instead of normal heart rhythms. The blood pressure cuff was inflating and deflating in time with her humming, and the IV pump was running at precisely calibrated intervals without being programmed. Excuse me, I said softly, not wanting to startle her but needing to understand what was happening. Can you hear me? Her eyes opened immediately, and the humming stopped. All the medical equipment returned to normal function as if nothing unusual had occurred. I apologize, she said in that same calm, detached voice. I was running a diagnostic check on the room's medical systems. Everything appears to be functioning within acceptable parameters. The casual way she described what had just happened was almost more unsettling than the event itself. A diagnostic check? Dr. Chen asked, stepping closer to the bed. How were you able to interface with the medical equipment? The woman tilted her head slightly, as if the question puzzled her. I'm not entirely certain. The capability seems to be part of whatever knowledge system I'm accessing. I can sense electromagnetic fields, radio frequencies, and digital signals from the equipment around me. This was no longer a medical case. We were dealing with something that operated beyond the boundaries of human biology. And the implications were terrifying. If this woman could interface with medical equipment, what other systems might she be able to access or control? Dr. Chen made the decision that would ultimately lead to my resignation from Mercy General. I'm calling in federal authorities, she announced. This situation is beyond the scope of emergency medicine. We need specialists who deal with unexplained phenomena and potential security threats. Within 2 hours, our emergency department was swarming with federal agents, military personnel, and individuals in civilian clothes who refused to identify themselves or their agency affiliation. They cordoned off room 12 and the surrounding area, interviewed every staff member who had contact with the patient, and began conducting their own examinations and tests. I was questioned extensively about my interactions with the woman, my observations of her behavior, and any unusual occurrences I had witnessed. The agents were professional, but clearly concerned about the implications of what we had. They discovered all the papers she had written on, confiscated the medical equipment from room 12, and restricted access to her case files. The most disturbing part of the federal investigation was what they told me about similar cases. Agent Williams, who seemed to be leading the investigation, revealed that there had been at least 8 other incidents across the country over the past 2 years involving individuals with similar presentations. All had been found with no identification or memory of their past. All had displayed impossible levels of specialized knowledge in various fields. And all had demonstrated abilities that defied conventional understanding of human capabilities. What happened to the other cases? I asked Agent Williams during one of our interviews. That information is classified, he replied, but I can tell you that understanding these individuals and their capabilities has become a matter of national security. On my final day of questioning, I was allowed one last visit to see the woman in room 12. She had been moved to a more secure area of the hospital, but the federal agents permitted me a brief conversation under their supervision. When I entered the room, she looked exactly the same as when I had first met her 3 days earlier. Same calm demeanor, same intelligent green eyes, same unsettling composure in the face of extraordinary circumstances. "I wanted to say goodbye," I told her. "They're transferring you to a different facility tomorrow." She nodded as if she had expected this outcome. "Thank you for your kindness, Sarah. You treated me with compassion even when my situation became frightening and confusing." "Do you remember anything more about who you are or where you came from?" I asked, hoping against hope that she might have recovered some fragment of her identity. She was quiet for a moment, and when she spoke, her words chilled me to the bone. "I remember more than I did when I arrived, but not about my past. I remember my purpose now. I was sent here to observe, to learn about human medical practices and emergency response protocols. My mission is nearly complete." The casual way she described having a mission and being sent somewhere by unknown entities confirmed my worst fears about what we had been dealing with. Before I could ask any follow-up questions, Agent Williams gestured that my time was up. As I left room 12 for the final time, the woman called after me. "Sarah, you should know that there are others like me already integrated into your society. We're not here to cause harm, but humanity needs to prepare for significant changes in the coming years." I submitted my resignation the following morning. The federal agents made it clear that I would be required to sign extensive, non-disclosure agreements, and that discussing this case with anyone could result in serious legal consequences. They provided me with a cover story about the patient being transferred to a psychiatric facility for specialized treatment of her amnesia, but I couldn't continue working in emergency medicine knowing what I had witnessed. Every patient who came through our doors made me wonder if they were truly human or something else entirely. Every unusual case, every unexplained symptom, every patient with missing identification triggered memories of those 3 days in March that had shattered my understanding of reality. The woman's final words haunted me most of all. If there were others like her already living among us, how many had I encountered without realizing it? How many of my colleagues, my friends, my neighbors might not be what they appeared to be? I moved to a small town in eastern Oregon, where I now work as a school nurse, treating scraped knees and checking children for fevers. It's simple, predictable work that doesn't challenge my fundamental beliefs about the nature of human existence. But I still think about her every day. I wonder where the federal agents took her, what they learned from their investigations, and whether the significant changes she warned about have already begun. Sometimes I catch myself scanning the faces of parents during school pickup, looking for that same unsettling composure she had displayed. That clinical detachment seemed out of place in someone experiencing complete memory loss. Last month, a substitute teacher came to work at our elementary school for a week while Mrs. Peterson recovered from surgery. She was pleasant enough, professional, and competent, but there was something about the way she interacted with the children that reminded me of room 12. The substitute knew things she shouldn't have known. She could identify which children had learning disabilities just by watching them work for a few minutes. She spotted a potential vision problem in a third grader that none of us had noticed, despite the child being in our school for 2 years. When I asked her about her background in special education, she gave me that same tilted head expression I remembered so well. "I have experience working with children who have various needs," she said in a tone that was perfectly appropriate, yet somehow felt rehearsed. But she couldn't provide specifics about where she had worked or what training she had received. Her references checked out according to the principal, but something about her felt fundamentally wrong. On her last day, I found her in the empty classroom after hours, standing perfectly still in the center of the room with her eyes closed. When I knocked on the door frame, she opened her eyes immediately and smiled that same calm, measured smile. "I was just reviewing the week's activities," she said, as if standing motionless in a dark classroom was a normal way to conduct such a review. "The children here are developing well within expected parameters." Expected parameters. That phrase sent ice through my veins because it was exactly the kind of clinical language the woman in room 12 had used when describing her diagnostic check of the medical equipment. I began paying closer attention to unusual incidents in our small community after that. The new pharmacist who could calculate complex drug interactions in his head without consulting any references. The mechanic who diagnosed car problems by placing his hands on the hood and standing quietly for several minutes. The librarian who seemed to have read every book in the building and could recall specific passages word for word. Each of these individuals was highly competent, professionally appropriate, and completely lacking in the small personal details that make people human. No family photos on their desks, no stories about their weekends, no complaints about the weather or local politics. They performed their jobs with mechanical precision and interacted with others in ways that were polite but somehow hollow. Sometimes I wonder if I'm losing my mind, seeing patterns where none exist. But then I remember those 3 days in March and the woman who changed everything I believed about reality. Her warning about significant changes coming for humanity echoes in my thoughts every time I encounter someone who seems just a little too perfect, a little too knowledgeable, a little too detached from the messy complications of being human. I may have left emergency medicine, but I can't escape the feeling that my real work is just beginning. Watching, documenting, and trying to prepare for whatever comes next. Because somewhere out there, federal agents are still investigating cases like hers, and others like her are walking among us, learning our systems, studying our responses, and waiting for their missions to be complete. The truth is, I don't know if sharing this story will make any difference. But if you've made it this far, maybe you're the kind of person who needs to hear it. Maybe you've encountered someone who made you question what it really means to be human. Trust those instincts. Pay attention to the details that don't quite add up. And remember that sometimes the most dangerous mysteries are the ones hiding in plain sight, wearing familiar faces and speaking with voices that sound almost, but not quite, like our own.